All right, welcome everyone. In today's clinical masterclass, we are diving deep into one of the most powerful tool sets we have in dermatology, lasers. We're going to break down the core differences between ablative and non-ablative technologies to really help you optimize your treatment plans and, of course, improve patient outcomes. So this is really the central question we face in the clinic, isn't it? The technology itself is just incredible, but choosing the right laser for the right patient and the right condition, that's where our clinical expertise really makes all the difference. So how do we make that choice with total confidence? Well, let's build a framework to do exactly that. Okay, here's our game plan. We'll kick things off with a fundamental concept that governs all of this. Then we'll get into the nuts and bolts of how each type of laser actually works, what their best clinical uses are, and, super important, which skin types they're safe for. We'll also compare the results in recovery, cover the non-negotiable safety rules, and finally tie it all together so you know exactly which technology to choose. Let's get started. To really master lasers, you have to start with the one foundational principle that makes them so incredibly precise. Honestly, it's a concept that completely revolutionized our entire field. It all boils down to this one idea: selective photothermolysis. This is the magic right here. It means we can use a very specific wavelength of light to hit a specific target, a chromophore, in the skin. Think of it like a smart bomb. We can precisely destroy melanin for pigment issues, hemoglobin for vascular stuff, or even water for resurfacing, all while leaving the healthy tissue around it totally untouched. If you get this concept, everything else just falls into place. So keeping that principle of selective targeting in mind, let's see how this actually plays out differently in our two main categories of lasers, the ablative and the non-ablative. Okay, so this slide just lays out the difference in strategy so clearly. On one hand, you have ablative lasers like CO2 and erbium YAG. Their main target is water. So they work by literally vaporizing the superficial layers of the skin. It's a true resurfacing. On the flip side, non-ablative lasers are much more subtle. They bypass the top layer of skin completely and use wavelengths that get absorbed by specific targets deeper down, like melanin or blood vessels. This creates a controlled thermal injury that kicks off collagen production from below, all without ever breaking the skin's surface. To make this crystal clear, let's use a simple analogy. Think of an ablative laser like aerating a lawn. You're punching these tiny, controlled holes in the surface to force a complete renewal from the top down. A non-ablative laser, that's more like gently warming the soil from underneath to encourage new growth without ever disturbing the grass on top. One is a top-down approach, the other is a bottom-up approach. All right, so we've got two very different ways of working. This naturally leads to the next crucial question: which conditions, and just as importantly, which patients, are the right fit for each of these technologies? And this just shows that clinical connection perfectly. Ablative lasers are our heavy hitters. We bring them out for the big stuff: significant textural issues like deep wrinkles, severe sun damage, and those tough atrophic acne scars that need a major remodel. Non-ablative lasers, on the other hand, are our versatile workhorses. They're fantastic for a whole range of concerns like moderate photoaging, specific pigmented or vascular spots, and of course for hair and tattoo removal, where the goal is to sap a specific pigment, not the whole skin structure. Okay, and this is maybe the most critical safety point. Patient selection based on skin type is absolutely non-negotiable. With ablative lasers, the risk of post-inflammatory hyperpigmentation, or PIH, just skyrockets in higher phototypes. For our patients with Fitzpatrick skin types 4 through 6, non-ablative lasers are, without a doubt, the safer way to go. And specifically, longer wavelength lasers like the ND-YAG at 1064 nanometers are the gold standard. They go deeper and are less absorbed by melanin in the epidermis, which dramatically cuts down the risk of pigment problems. And all of this, of course, directly impacts the conversation we have with our patients. So let's break down exactly how to manage expectations when it comes to the results, the downtime, and the potential side effects for each of these approaches. So here it is, the fundamental trade-off, plain and simple. Ablative lasers can give you those truly dramatic, life-changing results, often in just a single session. But that power comes with a price tag, a significant recovery period. We're talking swelling, crusting, intense redness. Non-ablative procedures, on the other hand, offer a much gentler path. The results are more gradual, and you'll need a series of treatments, but the trade-off is huge for many patients. Minimal to zero downtime and a much, much lower risk profile. And this right here, this is a perfect example of what to expect after a non-ablative treatment. You're looking at some mild redness or erythema. This is a totally common, expected response, and it's very temporary. This kind of redness usually clears up within about 24 hours, letting the patient get right back to their normal life. It's a whole different world compared to the weeks of recovery needed after a full field ablative procedure. Now, while they are generally safer, it's still so important to know the potential side effects with non-ablative treatments. Discomfort? Yeah, that's common, but it's manageable. Redness is expected. With certain lasers, like a pulse dye laser for blood vessels, you're definitely going to see some bruising or purpura. And with Q-switch lasers for tattoos, a little blistering and crusting can happen as that pigment gets broken up. And again, I can't stress this enough, we always have to be on the lookout for PIH, especially when we're treating patients with higher phototypes. All right, now for what is arguably the most critical section of this entire guide, because it doesn't matter how amazing a treatment is if it's not safe. Patient safety is everything, so let's review the essential protocols to prevent complications. Think of this as your non-negotiable pre-flight checklist. First, you always take a detailed history, and you have to specifically ask about herpes simplex. For any patient with a history, antiviral prophylaxis is mandatory to prevent an outbreak. Then, before you even turn the laser on, you've got to make sure the skin is properly cleaned with a non-alcoholic solution. And finally, giving crystal clear post-procedure instructions on hygiene is absolutely critical to prevent any secondary infections. And these are the absolute red flags, the hard stops. We do not perform laser treatments on patients who are pregnant, have been on isotretinoin recently, or are taking medications that make them sensitive to light. Treating tan skin? That's just asking for complications because of all that extra melanin in the epidermis. And of course, a personal history of photosensitive diseases or a tendency toward bad scarring are clear contraindications. Screening for these is just a fundamental part of our job. Okay, so we've covered the science, the applications, and the safety. Let's pull all of this together now into a really straightforward decision-making framework you can literally use in your clinic tomorrow. This table pretty much boils it all down into 3 common scenarios. 1. Your patient wants those big, dramatic results for deep wrinkles or scars. They have fair skin, and they can handle the downtime. Boom, ablative is your go-to. 2. The goal is more about a gradual improvement of texture, pigment, or vessels, and the patient wants a quick recovery. Well, for any skin type, you're looking at a non-ablative laser. And 3, for your patients with higher phototypes who need hair or tattoo removal, the answer is crystal clear. A long-pulsed Nd:YAG is your safest and most effective tool. And to wrap things up, here's a little food for thought to take with you. The rise of fractional technology, which delivers energy in these tiny microscopic columns, leaving the surrounding tissue intact to speed up healing, is really changing the game. As these platforms get better and better, offering results that look like ablative with a recovery that feels like non-ablative, we have to ask ourselves, is this classic black and white distinction becoming, well, a little obsolete? It's a really exciting question, and it points to the future of our field. Thanks so much for joining me for this guide.